Welcome to the Pharmacist Voice podcast, where we explore pharmacy topics and careers so you feel connected to the profession of pharmacy and inspired to contribute to it. I am your host and Ohio pharmacist, Kim Newlove. This is episode 303, and you can find the show notes on thepharmacistvoice.com. November is National Men's Health Awareness Month here in the United States, so registered pharmacist Greg McKettrick is on the show today to talk about important men's health topics. We keep it clinical, but listener discretion is advised. Our conversation covers sexual intimacy, mental health issues, medical devices, and other mature topics. Again, listener discretion is advised. Next, I'd like to introduce my guest. With over 3 decades of experience in the compounding industry, Greg McKettrick serves as a clinical liaison and men's health specialist at Revelation Pharma, which is a national network of 503A and 503B compounding pharmacies dedicated to providing industry-leading pharmaceutical compounding services. Previously a compounding pharmacist at Stanley Specialty Pharmacy, Greg is a powerful voice in the world of men's health and men's sexual wellness, drawing on his years of experience to elevate Revelation Pharma's industry presence. In addition to his role at Revelation Pharma, Greg is a chief medical advisor for the BHRT Training Academy, having designed the organization's men's health module. And Greg is also on the Scientific Advisory Board for Berkeley Life Nitric Oxide. Greg is also a frequent speaker for Zero Cancer groups and presentations. By the way, quick sidebar, Zero Cancer or Zero Prostate Cancer is a national nonprofit organization that works to end prostate cancer and support those affected by the disease. To learn more, visit zerocancer.org. That's ZERO cancer, CANCER.org, zerocancer.org. All right, back to Greg's introduction here. A true thought leader in the industry, Greg developed his post-prostatectomy penile rehabilitation protocol, which is used by urology clinics around the country. He has also been featured in numerous articles and as a guest on many webinars and podcasts, including now episode 303 of the Pharmacist Voice podcast. That's this one. That ends Greg's introduction. I would like to say for all of the pharmacy professionals listening to this, Greg changes lives. If you know at least one person who could use the information in this episode, please share it. Whether it's a patient, another pharmacist, another student, or another healthcare professional, especially a urologist, please share this episode. This interview could change someone's life. Without further ado, here is my conversation with registered pharmacist Greg McKettrick. Hi, Greg. Welcome to the Pharmacist Voice podcast.
Thank you, Kim. Happy to be here.
Well, as we record this, it is Halloween, but this is going to be broadcast in November during Men's Health Month.
I'm excited about that. Love to get news out to guys.
Yes, I appreciate you being on the show. I understand that you know a lot about men's sexual health, so we are definitely going to talk about that today. And I want my audience to know that you are a resource. And also, I got to say, a compounding role model as well, if I don't say so myself.
Thank you so much. I appreciate that.
You're welcome.
Yeah, in terms of resources, we try to make sure that we're able to provide as much information as possible. And the nature of compounding really at its core is finding solutions to problems that don't exist out in the commercial world. So that kind of fits the description.
I like people that fill gaps. I feel like there was a gap in care for people who were post-prostatectomy, and you created something that could really help them, both as a compounding pharmacist, but also as a human, really, just realizing that there was a gap. So as we open up, I would love for you to talk about what's that gap that you identified and how are you filling it?
As backstory, so that folks kind of have a better picture of everything, working in compounding is a little different than in retail setting or even hospital setting, because again, a lot of what we're doing is very, very patient specific and problem oriented. So I was doing a lot of work with sexual function for both men and women, but a lot of ED for guys, and kind of got to the point where I had enough of a reputation where I was getting a lot of referrals from urologists. And unfortunately, a lot of those referrals were when the urologist office were kind of throwing their hands up in the air. They didn't know what to do anymore. And through the course of hundreds of consultations, it started to become very clear there was a repetitive story that I was hearing. And I guess the best way I can tell you this and have it make sense is if you're sitting in a counseling room with a grown man who is explaining to you that he's post prostatectomy or has had significant ED for a long period of time. For a lot of these guys, they're incontinent. So, think maybe 10 years of wearing Depends, 10 years of no sexual function, 10 years of no intimacy, 10 years of, relationships on life support, 10 years of self-esteem that has literally taken a kick to the gentle parts. And when you're sitting in a room with a gentleman and there's literally tears coming down as they're explaining their story to you, if you don't start to build up an empathetic response to that, then you're in the wrong field. And what I learned quickly through my own work was that, a lot of these, especially the post-prostatectomy guys, unfortunately what happens is they go through the process with their doctor, PSA climbs, they start going in, they get a biopsy, and the next thing they hear is a cancer diagnosis. Well, I will tell you that for a lot of them, as soon as you hear the word cancer, everything becomes white noise. If there was instructions given by their care team, a lot of the times it's just missed. So then they get referred to a surgeon or an oncologist, and that physician is responsible for getting rid of cancer. And one of the things I found relatively early was that a lot of these patients, they basically get a pat on the back from their surgeon, says, "Okay, we got the cancer. Go have a good life. Oh, here's a prescription for Viagra for you." These guys go home and Viagra does nothing for them, and they're incontinent, and they have long-term ED, and sometimes more than that. And they literally have nobody to talk to about it. They feel like, they're out there trying to find answers. And this was what we kind of termed as the gap in care, because they flounder for sometimes it's months, sometimes it's years, sometimes it's more than a decade trying to find somebody that can help. And that was what really prompted me. That's when I actually designed what we termed the post-prostatectomy penile rehabilitation protocol. And we published it and we've shared it all over the country. We work with different physicians and clinics. We work with hospitals. We've actually done a lot of work with other pharmacies doing this, trying to make this available on the largest scale possible for patients.
Thank you for explaining all of that. I understand that there are people out there who suffer and they go to the internet to try to find solutions. When they're searching on the internet, how likely is it that they're going to come across your protocol?
It's becoming easier because through searches and through just the magic of Google, the more hits it gets, the more easily it pops up. The problem is there's a lot of bad information out there, and again, one of the things that I really took to heart, and I'll share this, patients that have been actually scheduled, they've been referred by their physician for a consultation for the protocol. The doctors essentially ordered this for them. And in their waiting period until they came in for the consultation, one case in particular, I had a phone call from a woman who was explaining that her husband was not going to make his appointment that day. And I said, "Well, don't worry, no big deal. We can reschedule." She said, "No, you don't understand." She said, he was so despondent because he was going down the Google rabbit hole and found so much negative and discouraging information. He actually put his car into a tree, and she was calling me from the hospital. He had just had surgery to reconstruct his leg. And so of course, I said, well, listen, when he's ready, you come back. And she said, no, you don't understand. She says, he's being discharged tomorrow. We need to come in immediately. We're not even going to go home. He has to talk to you. Otherwise, I'm afraid he's going to do the same thing. So there's a lot of bad information. My website is designed so that patients can find good information, reliable information from really cutting edge facilitators in this line of work. And of course, there's no charge. This is literally like the public library of resources as far as the patients are concerned.
I found a lot of great information put out by you and Revelation Pharma on YouTube. And I know that you talk about your website, which is revelationpharma.com, correct?
Revelationpharma.com, but then my specific site is penilerehabprotocol.com. Both linked together. Most of my information is now on penilerehabprotocol.com. A lot of the recordings, a lot of the presentations that I've done are they coexist on the Revelation Pharma site as well.
Resources are so important. Getting the right information out there is very important. In fact, there may be a pharmacist or a pharmacy student listening to this right now who's going to go to that website and check out your protocol and maybe consider reaching out to you to find out how they can change some lives too. Because it's wonderful that you've got the protocol out there, but I've got a question. If a pharmacist or pharmacy student were to look at that protocol, would they know what to do with it just by looking at it?
I will actually share the printed protocol that when I designed it, again, I apologize for this, it's probably 8 years ago, and on a loose leaf piece of paper sitting with a urologist friend of mine, and we kind of scribbled the notes. And I said, do you think this is something that would work? And he said, well, yeah, it'll work, but you have to put it together in, a form that doctors are going to look at and recognize. So the full protocol goes step by step. There's absolutely guidelines on how to do this. Now, there are some factors that I think it takes a little bit of exposure to work with the patients, to be able to understand, to do their intake evaluations. And as far as we do monthly progress checks with them. So you have to know how to evaluate how they are working through this and where they're still having struggles. But every single bit of it is reproducible. And that really was the key element. We wanted this to be something that was easily understood, that was not going to be some ridiculously expensive, cost prohibitive practice. This is something that pretty much any pharmacy certainly can adopt. I would love to say that clinics would do it, but unfortunately, a lot of the clinics, due to time restraints, due to resource restraints, they just don't have the capacity, or call it money, funding, timing to carry this out. And that's why it really puts us as pharmacists in an ideal situation.
You bring up some good points about having the time in your schedule to conduct that intake evaluation.
Mm-hmm.
I think you also have to be the right messenger. I know that you opened up by saying that as a compounding pharmacist, you identified this gap. You, for years, had been in the compounding space and making all kinds of medications, testosterone, I can imagine, topical. I think there's a number of things, sublingual PDE5s. Before we started the interview, we talked about some of these things.
Mm-hmm.
Sorry to my audience who were not part of that conversation. But I think you kind of somebody needs to be the right messenger. I don't know if I, as a woman, would be somebody that the patient would be willing to talk to. In your experience, what kind of a pharmacist really do your patients respond best to?
Empathetic.
Okay.
I mean, I think that there's certainly an advantage when, if I'm dealing with men and they look at me and they say, well, this is an old guy with gray hair, gray beard. He's probably heard it all, seen it all, and has gone through it. So he's an easy one to talk to. But really what it comes down to, and this is something where, and I have trained female pharmacists and young men pharmacists that come through. A lot of them started as interns and worked their way through this. But it's really about, number one, being empathetic in terms of how you interact, giving information with confidence. Don't act like you're kind of second guessing yourself as you're passing this, because If the patient doesn't feel confident in what you're saying, they're not going to absorb that very well. And then being very responsive. So, active listening, put the heart on while you're talking to these guys, because for most of them, and I would say the same thing for female sexual dysfunction, for a lot of folks, these are uncomfortable conversations. These are highly personal and intimate conversations. We're talking about things that impact not just their quality of life, but their relationships, their ability to maintain intimate relationships. So a lot of these things, they're telling me or the pharmacist that they're talking to that they would not talk with, to their best golf buddies, because it's just too personal for them and embarrassing in a lot of cases.
I come from a generation where you just don't talk about sex. You just don't, maybe with your inner circle. And I understand that that may be the case with some of the patients that you work with. And I understand that empathy, of course, is very important. Knowledge is important too, though, and the ability to conduct a meaningful conversation. There's a little bit of give and take. Like, you need to get an accurate patient history. And I'm sure that's something that you've done many, many, many times. And getting people to open up and earning their trust, there's a nuance to it, I'm sure. But as far as the knowledge and going to your website, if someone were to go to penilerehabprotocol.com, they wouldn't necessarily know, just innately how to have that empathy, how to conduct that conversation, how to earn that trust. But can you walk me through the protocol, even though I don't know how to, conduct an interaction with a patient and do an intake appointment? What would the protocol entail?
So the protocol itself it's a prescription, number one, because we are not taking prescription authority away from the primary care doc or the urologist in most of these cases. So they refer the patient over, and initial steps with this is a contact point with the patient where we basically explain what the protocol is. This is a rehab pathway, step by step, to walk them through recovery of sexual function, of continence, in a lot of times in just the tissue rehab, in terms of reversing and putting brakes on any atrophy or fibrosis. Once they acknowledge this, then we initiate what is called the intake survey. And I have a printed, if folks are at all familiar with urology, there's a shim test that urologists use, a sexual health inventory for men. And it's a basic question that goes back and asks a lot of questions about sexual function and their history. I have modified that on our intake because there's information that I need that doesn't cover. But what we need to know, what was the patient history prior to, whether it's prostate cancer or the onset of ED, whatever the situation is. What other disease states are we working with? Is there heart disease, diabetes? Is it an obesity issue? Is there circulatory function? Depression? Is there anything to that effect? Hypertension? So we want to have a complete picture of all of the factors that are leading into this. And then once we have that, we kind of have a better pathway of exactly how to proceed. General patients, once they go through a prostatectomy, there is a period of time post-prostatectomy where they're going to have a catheter in. That stays in for approximately a week. And then the recovery period post-surgical before we can really start any heavy-duty stuff is about a month. But as soon as they are out of surgery, we start them on a daily tadalafil, the PDE5, and a dietary nitric oxide complex. And this is extremely important, especially if these patients are, late 40s, 50s, 60s, 70s, because they have to have both components to really maximize the function and reestablish good, healthy blood flow. So that's the initial step. And then we introduce and train them on how to do Kegel exercises, which are exercises to help to train the pelvic floor muscles so that we can restore continence for these patients. If the patients don't respond to pelvic floor physical therapy like that, we actually refer them. We've got a nationwide network of specialists, they're pelvic floor physical therapists that really focus just on that. So Kegels first, and then we step to that. Once we have gotten past the discomfort of the surgery, we initiate rehab using a vacuum pump, a penis pump, vacuum erection device. We use medical grade vacuum erection device, and it is for physical therapy. The reason that we do this is because there is a known fact that within 4 months of a prostatectomy, and typically they say the window is 4 to 8 months, but it can actually start sooner, you start to see the atrophy of penile tissue and the initiation of fibrotic tissue setting in. So there is a physical shortening of the actual penis due to the prostatectomy because they're actually they're removing a small piece of urethra. So there's going to be a nominal size change regardless. But, and I use a lot of analogies, there's a very common term, it's a medical term, it's called use it or lose it. And for penile atrophy, for lack of use, if men are not getting routine erections, that tissue starts to shrink up. You start to lose elasticity. You start to develop fibrotic tissue in there. The blood vessels start to weaken. They're not fully perfused on a routine basis. So we use a vacuum pump as physical therapy. And this is doing a couple of sets using the vacuum pump a couple of times a day, pumping up, holding an erection, releasing, pumping up, holding the erection, releasing. By doing this, we restore size, we restore blood flow, we reperfuse the tissue, and we keep any atrophy or fibrosis away. That is really the initial steps of the process. And then what happens is typically it's a monthly basis. We meet back with the patient, and a lot of this is done virtually, but we'll meet with the patient and we'll kind of go through all of these points in terms of progress notes. Those notes are sent to their physician because what we want to do is make sure that the care team is all on the same page. Incorporated in those notes will be any recommendations in terms of changes of therapy. So as we start to see the return of function, then we can become a little bit more aggressive. And again, we might use, in addition to that daily tadalafil, as you mentioned, a lot of times for more aggressive response, we'll use a sublingual version of a PDE5. If folks are at all familiar, if they're on the internet or watch TV, you see a million ads anymore for Hims and Roman and Rugiet and Lemonade and all the rest of these great new novel ideas that compounding pharmacy has been doing for over a decade without the fanfare, and using combinations of PDE5s, using other ingredients that benefit the patient. And the reason that the sublingual is more effective is, the tablet has to go through the GI system. It goes through first pass metabolism. It's influenced by stomach content. Well, the sublingual is absorbed through the oral mucosa, goes directly into the bloodstream. So it absorbs about 4 times as fast as a tablet. And first pass metabolism will actually remove about a third of that active ingredient before it hits the bloodstream, whereas the sublingual, it is avoiding that. So you're getting stronger, higher bioavailability, delivered faster. And then we can get inventive with these things and use combinations, use different PDE5s in concert. Sildenafil and vardenafil are very rapid onset, whereas tadalafil lasts for a long time. So if you mix those together, you get an extended benefit for patients where they get the rapid response plus, it lasts them for a day and a half. For other patients who are having issues with ED or with anorgasmia, inability to climax, you can incorporate things like oxytocin. Apomorphine is another great one. It's a dopamine agonist, and it actually works in the hypothalamus. It stimulates the initiation of the erectile cascade, plus it gives a little dopamine kick, so some libido in there as well. So again, there's a lot of things that we can do to add function to these guys, and then based on how they respond to that, they may progress into a penile injection, which commercially, if you're familiar with Edex and Caverject, which that's alprostadil or prostaglandin. Through compounding, we'll use different vasodilators in combinations. And the thing about the compounding is those formulas can be tailored to suit the individual needs of the patient. Different components are responsible for different pharmacological activity and different physiological response, firmness, duration, sensitivity. are all factors that we can actually manipulate in those formulas. So as we walk through that process, what it is, it's really, I call it building block therapy. And, the physical therapy component, the supplement, and that daily Cialis, those are first base, and that's what you continue. You actually maintain that going through. We also will train patients that they can use those vacuum pumps for intimacy because they are available with the retention rings. So what you probably think of or are more familiar with what a penis pump would be used for, we do train them on how to use that so that they can reestablish intimacy. In addition to that, for patients who have had longer periods of celibacy, and again, it's a penile rehab and really was designed for post-prostatectomy, but it's suitable for guys who have long-standing ED, long-standing diabetes. Another population are these folks that they were in long-term marriages and their spouse passed away, and for a lot of them, they will become very inactive, and 5 or 10 years down the road, they meet somebody. Well, again, think about the use it or lose it, and with age and the decline of systemic nitric oxide and circulatory function, these folks need help. So, there's a lot of things that can come into play with this. But, the key to this is letting them know that it's a step-by-step process. And there's really never a point where the answer is no. It's just what's next. And then as we progress through that, we see these guys, they start to restore continence. They get back to where they're having sexual function. If it's long periods where they've been inactive, and unfortunately, especially for men, if you can't perform sexually, you typically will withdraw from all forms of intimacy. So it's not unusual to see, no hand holding, no kissing, no cuddling. Their mindset is, if I can't finish the race, I'm not going to start the race. So I actually also have sexologists that we work with for intimacy counseling. These are licensed sex therapists, not sex workers, but psychological and skill set folks who can incorporate training and kind of reunite couples.
The protocol makes a lot of sense, and I think there's a lot of options. It provides a lot of options. I can only imagine how much hope it gives your patients.
Right.
Yes. And I've got to ask something. You kind of referred to this as physical therapy, right?
Mm-hmm.
So I know that a lot of people undergoing knee replacement, hip replacement, etc., like my sister-in-law had to have a hip replacement even before the age of 40. And I think she started physical therapy prior to the surgery. Can you tell me, is this something, this protocol, is it something that a man could start prior to his prostate surgery?
Yeah. We actually ask for patients to be referred in prior. And the main reason for that is if they are going to go through a surgery that is most definitely going to affect their continence, doing these exercises, learning the pelvic muscle control, being familiar with that, establishing muscle memory is invaluable, because that will carry over when they come back and they're not getting the nerve response. Just so you can kind of have an idea of what the causative issues are. Best case scenario, when prostate surgery is done and it's completely nerve sparing, which gives the guy great outlook in terms of their long-term outcomes. The problem is that the nerves that are involved still become stunned, and they can be stunned for over 2 years. So every bit of this therapy that we do, the earlier we do this, the more we do at the early stages, the quicker we stimulate that nerve response. So there's really a proven in terms of linear progression from when we start. For continence, absolutely. Let's get started. Let's start doing Kegel exercises before you go in, because you're going to remember the muscles that you were using when you had the capacity to cut off your urine flow. Whereas after the fact, you are really going to have to learn that. So that absolutely is one of the requests that we have, is that they come to us prior to any invasive surgery.
I like that. Yeah, building that muscle memory. It just makes sense. That's smart.
Yep.
Thank you for sharing the protocol and the steps. Now, I know there's a lot of pharmacists in this country who are kind of looking for something else to do other than retail and hospital and traditional practice settings.
Mhm.
If somebody wanted to, for example, leave a big box retail store and go into compounding and help gentlemen with this issue and the penile rehab protocol, what steps do you think they need to take in order to do what you do?
What becomes the most important factor is really identifying what your niche is going to be. And again, I work with a lot of different things, but I work with a lot of female sexual dysfunction, hormone replacement therapy, BHRT. It just kind of fell on me. I became the guy's guy. So I started to go into every bit of educational information I could. How do I learn to become the expert? How do I learn to be the one the doctors are calling when they can't find the answer? So number one thing is identify what your point of interest, what is going to be your passion in terms of what you do for work, and then become the expert in that. For this, it's partly physiology, big part is pharmacology. Unfortunately, a lot of it is psychology as well, because you're working with, again, these components where the counseling that we're doing, although it is more to find out how they're moving through the process, you have to have the human factor in there and be able to relate with them. That's where the hope comes from. It's not just pointing them in a direction and saying, you see the light way down there? No, it's like, hey, that light's going to get brighter every step we take, so stay with me. But getting into it, learning this process, again, this is not really rocket science. And when I did the protocol, I didn't invent anything. I took what was proven and all I did was put it into a very comprehensive kind of step-by-step package that was easy for prescribers to understand, easy for patients to follow, easy for pharmacists to duplicate.
I appreciate you sharing that with me. I think that there's a bit of a learning curve to this, meaning I think for somebody to go from a big box store
Mm,
to doing this sort of work, they have to have a mindset shift, right? Being
yeah.
one on one with a patient and really being of service and being a good listener and asking good questions too. But then would you recommend that they start a compounding pharmacy or go work at one? Or, how do they get the buy in from the urologists? There's a lot of questions, Greg.
Before anybody is going to go out and invest the money that's involved in building up and starting a compounding pharmacy, because it's a expensive ordeal anymore. Back in the day, you could kind of do this. You could run a conventional pharmacy and kind of have a little side job there where you're doing some compounding. But all of the regulations and changes with USP and how the FDA is looking at these things now, this is a big investment because just the equipment, the facility, everything that goes into it. So I would highly suggest going and visiting a compounding pharmacy, seeing what that's like, talking with, again, somebody like myself who's been doing this, who can kind of give them the ins and outs and how to approach it. Um, and then, if it seems to be something that excites them, then go and work in it, do it, and become, again, like I said, really proficient in this field. That way you're comfortable, because it is when you're coming from retail and you're filling commercial products and you're pulling it off the shelf and you're counting to 30 and 60 and giving a 10-second consult because that's all the time you have because you've got 17 phones ringing in the drive-through and all the rest of it. This is different. This is where you got to get your head out of the fulfillment pharmacy mindset to where now you're actually taking this. And here's the other aspect, which probably will be of great interest. This is a cash business. So cash consultations. A lot of these products are going not to be going through insurance or prior authorizations. So there should be a lot of motivation for anybody who's looking to build up their bottom line, because when you get into this now, will the urologist send their patient to the corner drugstore because that pharmacist has started doing this? No, you're going to have to build that up. That means you have to be proficient. You have to be able to go into that urology clinic and start talking their language. and presenting them with maybe some novel ideas that they haven't really maybe understood, delivery methods, combinations of different pharmacological agents that affect the body in different ways. So you got to tweak them a little bit and really kind of get them interested. And then, you know, my favorite thing to say to any doctor that I meet is, give me one patient, give me one guy. Let me have one guy, and if they're not happy with what comes out, so be it. If they are, give me another. And that's usually the best way to build up that confidence. You start with a little bit and start introducing that information.
Great advice. Thank you. I was talking about, going from retail to compounding. How about if somebody's already in the compounding space and they've been doing lots of compounding, but just not this, or
Mm-hmm.
working with urologists? I feel like your advice to ask a urologist for just one patient and get started there is great advice. Any other advice for pharmacists who are already compounding pharmacists?
So again, the second big question when you go in, what are you having problems with? What are you having issues finding? I'll give you an example. When generic clomiphene went off the market, PAR discontinued it. So then there was only brand name Clomid left on the market. That became very difficult for a lot of these offices that use it. So being able to present them with a compounded version, which was available, maybe incorporated something else like DHEA, whatever the case was, but letting them know, hey, if you're having a problem finding this, we can source this for you. We can help you with this. Or, do you have patients that, they're struggling, they're using PDE5s and they're really resistant. They don't want to go to injections. Hey, let me work with them a little bit, because with a good supplement and with maybe a different delivery mode with these kind of medications, we might get them the response that they need. Open up some avenues that are going to help the physician's office. Let them know that you're open to doing consultations. If you save them time and you save resources for them, that's making them money in and of itself. If that helps with patient retention, that's huge. So you just became an asset to that office.
Great answer. I appreciate that. Now, how about when you talked about the payment? You talked about this being
Mm-hmm.
a cash business. Are you
Mm-hmm.
saying that as a compounding pharmacist who specializes in this post-prostatectomy protocol, that you get paid for your cognitive services in addition for the compounding? Is that what I heard you say?
Exactly. Yeah. Paid consultations are you wouldn't think twice if you were going to your dentist or the dermatologist or the OBG, whatever the case is, and they said, okay, well, there's an office charge for today. Well, for myself, and I'll disclose it, I don't care. This is for anybody who wants to know it. My consultations start at $50 for 15 minutes. It's $200 an hour. And, that's something that once patients and physicians really realize how much of a resource that is, that's nominal.
Awesome. I really appreciate you sharing that with me because I think pharmacists are number people, you know, and a lot of pharmacists out there want to get paid for cognitive services.
Mm-hmm.
And for you to validate that you are getting paid for your cognitive services, it's just great information for pharmacists to have. It gives them hope, Greg.
Well, and here's the thing, I think that our profession in general we've taken a beating, between insurance companies and the image that we have as far as, community pharmacies and the demands. You're filling more prescriptions with less help, plus you're doing immunizations. You're there, you've got to answer every phone call and the drive-through and then make recommendations. And, you're really not getting paid for your intellect, for that huge book of knowledge that you have. So this is where you can actually kind of put that to good use. You're the expert. And I do a lot of talks. I do talks for Boston Scientific with urologists. And one of the first things that they'll say in those talks is, I partner with Greg because he knows more about the pharmacology of all of this stuff than I'll ever know. He said, I can do surgery and I know physiology and I know the basics of the pharmacology, but when it comes down to it, I don't have to know that because I got him. And when you get yourself into that kind of a position where the expert is looking to you as the expert, boom, now all of that kind of comes home.
You become indispensable, right?
I hope so.
Yeah. Well, as we start to wrap this up, I would like to kind of end on this super happy note. I'm hoping it'll be a super happy note. You talked to me earlier about this individual who was so distraught that he
Mhm,
drove his car into a tree.
mhm.
And I'm not going to ask about that specific individual, but what is it like after somebody comes into contact with you and gets the help that they need and they have rehabilitated their sexual function and they are able to perform the way that they would like to perform? What is that like for you and for them?
So I'll give you a little story. And, one is, like I told you, a lot of times when these guys are getting referred to me, it's because their doctors have kind of thrown their arms up there. They don't know what to do. On multiple occasions, my first interaction with a patient has been, if you can't do anything for me, tell me right now. Now, imagine when you go through this process and you go through and all of a sudden you have a husband and wife who walk through the door, and the husband comes up and grabs you and puts you in a bear hug, and then the wife is kissing you on the cheek because you've just given them back the intimacy and the quality of life, and the ability to carry on the way they had always intended. So those are those moments where, I'm sorry, but you've invested time, you've invested, again, your cognitive ability in this, and now you see the fruit of that. And when that happens, that's the reward. Yeah, great, it's great to get paid for a consultation, but what's even better? When I get a phone call from somebody, and maybe it's 2 years or 3 years down the road, and they're like, I cannot thank you enough, because I had seen everybody, I talked with everybody, my doctors didn't know what to do, and you never gave up, and you were able to get me to what I needed to be. And it's a great feeling. And that's really, for all of us, I think that's what our goals are when we start into whatever the healthcare profession is. And I speak to PAs, I speak to nurses, I speak to doctors. Um, I'm at conferences, I'm at symposiums where I'm training physicians how to do this stuff. So it really is, this is the basis for why I do it, and for why we all really, I think, get up and we strive to do this. It's not so that we can fill 1,000 prescriptions and get paid 50 cents by the insurance company for the reimbursement, or for that matter lose money on it. And if we're working for another company, a big box, basically answering to every metric demand that they have, no, this is the reward, this is why we're doing this kind of stuff. um, it's because this is people business. This is the care, and it's called the practice of medicine. This is really being part of a care team when you become this involved.
You are changing lives. I think this is great what you do. I really appreciate you being here on the podcast to talk about it. As we wrap this up, anything else you'd like to add?
No, like I said, use the resources that are available. Like I told you, penilerehabprotocol.com is an open book. It's a resource page. It has a ton of great information in there. But really, it's about finding your niche. This is mine. Yours might be diabetes. Yours might be BHRT. It might be pediatric. It might be veterinary. Become the expert, because once you do that, you are invaluable. You possess knowledge that really nobody else out there has. Find the thing that you love, run with it. And if this is what you want to do, man, get with me, and let's build it up for you. But it's really about enjoying and finding the passion in how you practice.
Great advice. Are you inviting pharmacists to contact you if they're interested in doing
Of
the same
course,
thing? Yeah?
always.
All right.
Yeah, shoot my information out, my website. We mentioned Revelation Pharma. Revelation Pharma is a network of compounding pharmacies, 503As and 503Bs around the country. I am the director of Penile Rehab Protocol. I am part of what's called the Consult RX, our internal consulting team for physicians and patients. So I am one of the clinical representatives. I cover men's health for the country. And again, like I said, a big part of what we do is try to get people to understand and become more active, not just a fulfillment pharmacist, but really being practicing pharmacy.
Great parting words. Thank you for the invitation for people to get in touch with you and change lives also.
Absolutely.
That's a great opportunity. Greg, thank you so much for being here on the Pharmacist Voice podcast. Take care.
Thank you so much. Have a great day. Happy Halloween.
Thank you. Thanks again to Greg McKettrick for being my guest today on episode 303 of the Pharmacist Voice podcast. I did have a happy Halloween, by the way. As I publish this, it is November 8th, 2024, and we did record this on Halloween. I ate plenty of Halloween candy, and I must say that I like Kit Kat, Twix, and Reese's Peanut Butter Cups the best. Those are probably my top 3 of 2024. I hope you enjoyed Halloween as well. At this time, I'd like to share a recap of this episode and also share some final comments with you. Greg McKettrick is a compounding pharmacist and a clinical liaison. That post-prostatectomy penile rehabilitation protocol that he developed addresses gaps in care for men suffering from erectile dysfunction and incontinence after surgery. He highlighted the emotional and physical challenges that these men face, including long-term intimacy issues and self-esteem problems. Greg emphasized the importance of empathy, knowledge, and personalized care in his practice. He talked about the protocol, and he stressed the need for early intervention, even pre-op intervention if possible. He also mentioned the financial aspect, which I personally found really interesting. Not only does he get paid for cognitive services, but he can also charge for any compounded medications. By the way, compounding is not something that we talk much about on this show, but the mission of this podcast is to explore pharmacy topics and careers so you feel connected to the profession of pharmacy and inspired to contribute to it. This episode definitely explored compounding pharmacy and also consulting, which to me is getting paid for cognitive services, getting paid for your head knowledge. If men's health interests you as a pharmacist or as a pharmacy student, I invite you to reach out to Greg McKettrick. He mentioned that I could share his contact information, so you can find that in the show notes for episode 303 on thepharmacistvoice.com. I find his niche in the pharmacy profession to be very inspiring. If you feel inspired to, reach out to Greg. Let's wrap this episode up, shall we? Thank you for listening to the Pharmacist Voice Podcast, episode 303. To read the show notes, go to thepharmacistvoice.com, click the podcast tab, and choose episode 303. In the show notes, you will find Greg McKettrick's websites and contact information, one of his YouTube videos that I especially found helpful for understanding who Greg is and what he does. I also have the link to Zero Prostate Cancer's website, my social media links, and more. LinkedIn is my favorite on social media. Please feel free to reach out to me and connect. Please go ahead and share this episode with any patient, pharmacist, pharmacy student, or urologist who needs to hear Greg's message. And if you like this podcast, subscribe to or follow the Pharmacist Voice podcast on your favorite podcast player and YouTube to get each new episode right when it comes out. Thanks so much for listening today. I will talk to you next week.